I've been pretty fascinated on how the nervous system affects our foot posture. I think that our brains are and our nervous systems and our fascial system really also play a role in how the foot feels the ground. I've those patients that have the very high arched, rigid, stiff feet. I think that by doing breath work, for example, and meditation and walking outside and getting the nervous system to dial down a bit, I think that you can start to see, and I've actually done this in my office without even messing with the foot. You can start to see changes in that recoil by telling the brain and nervous system, hey, you better chill out because the foot is responding to the tension in the rest of our bodies.
Hi, I'm Lauren Parsons.
And I'm Andy Jackson, and this is the All Well Co podcast.
Dive deep with us as leading experts share their unique perspectives on topics such as recovery, sleep, movement, and the latest innovations in the space.
Well, welcome to the All Well Co podcast, Courtney. And before we dive into your journey, let's set the stage. Can you share how we first met and what drew you into the All Well Co community?
Yes. Well, first, thank you so much for having me. I'm always honored to be asked to be on these podcasts, so I really appreciate it. I think that would have to be years ago, right? When I think the kind of connection was through Vivo Barefoot. And so we had started communicating via social media, and then one thing led to another, and here we are.
Awesome. Yeah, Vivo Barefoot does pull us together. I think you're equally passionate about them as we are. Okay, let's get started. Can you start by sharing what kind of drew you first into studying gait, human movement, and basically how your company, Gait Happens, began?
Yes, I've always been, movement has always been my therapy, if you will, ever since I can remember, even when I was a child. And I was a dancer, and then I was a triathlete, and, you know, foot pain was kind of my Achilles heel, if you will. Always having bunions and neuromas and stress fractures. And when you can't walk or move because your foot hurts, it's a very debilitating diagnosis. With most other musculoskeletal injuries, you can still, walk. Your low back, you can walk. Your neck hurts, you can still walk. But when your foot hurts, it really stops you in your tracks. And when I can't move, not only obviously does my physical health get altered, but my mental and emotional health does not do well with that. So I've been kind of on this personal quest to figure this out from, when I was in, college. And so I went to chiropractic school, and we only had about, I think, a half a semester, maybe one, on foot and ankle. And basically what we learned was if the foot hurts, here's an orthotic, a foot orthosis. And if it hurts worse, here's a referral for a surgeon.
Mm-hmm.
And that kind of never jived with me. It didn't make sense. So I just became, just eager to learn more about this. And I still to this day am so grateful that I had been surrounded by so many wonderful mentors of mine, from podiatrists to, movement professionals that have really guided me along this journey. And so it was a personal quest really to figure out what was going on with my own body. And here we are. So I became very passionate about the foot and ankle. I have a practice out in Colorado, and it's pretty much all I do now. Gait Happens started probably about maybe 7 or 8 years ago. And this is actually a very funny story. I used to be an instructor for rock tape. So that was the kinesiology tape that,
Yeah.
and every year we'd go on an instructor summit. And so they'd bring all of us, to Mexico. It was super fun. And one of my good friends said to me, you really like the foot and ankle. She's like, she was big on social media, on Instagram at the time. And she was like, you really should just start posting about the foot. And I was like, really? And she said, yeah. And so she goes, just do me a favor. Make sure you do it every single day. Just be consistent. I said, okay. So I came back from our instructor summit, and every single day, and I mean Monday through Sunday, I would see patients all day long, come home, and it would take me like 3 hours to do one post because I had no idea what I was doing. I did it every single day, and we've been doing it every single day for the last 7 years. So
Well,
It's been
congratulations. Yeah.
yeah, it's been a labor of love, but, it's really been amazing to see, the growth and the interest in a topic that I'm frankly just so passionate about.
Yeah, I love that. So I'm sure this has changed over the years, just as you've started and gotten into it and where you are today. But what's your current mission or philosophy when it comes to helping people move better and live pain free?
It's such a great question, and I have reframed that so many times. I think when I first started, I would say that to my patients often. We're going to work on getting you pain free. And I have really watched that recently. I don't say that anymore. I think that pain is a normal human experience. And rather than telling people, our goal is to make you pain free, I think the education should be we create resiliency. We want you to be a resilient human. We want you to be able to move and to be able to navigate your body and realize that movement is a treatment, movement is medicine. And even when you are or may be in pain, that we can still find ways to navigate through that. And since I've kind of reframed that, I think it gives patients a kind of a different outlook
Hmm.
because, you know, if we say to our patients, "You can't do this until you're pain-free," we could be waiting a very long time because we know how complicated pain is.
Yeah.
So, it's one of empowerment, it's one of encouragement, it's a lot of education, and I think that has kind of changed definitely drastically over the years.
I love that. That's super interesting. I mean, pain is feedback, right? And if you take that away, then sometimes, where do we go from there? So I think that's a really interesting way to look at it. So gait's the word that, we're going to use often in this episode. For someone who's never thought about their walking pattern, what is gait? Why does it
Yeah.
matter?
Um, if you want the technical definition, a walking gait is when your right foot is on the ground and then you step with the left foot and then your other foot hits the ground. So that would be your stride length. And when you're walking, your gait, there's a lot of things that are happening. Probably way more than we think about. It's a very, very complex um, kind of form of movement, but we don't think about it because it's subconscious, kind of like breathing. It's just something we do. Um, and so biomechanically, there's a lot going on. But I think the beautiful thing about gait and walking gait in particular is that it's a window to someone's nervous system. You can watch someone walk and you can tell if they've been fired from their job, if they got a promotion, if they're,
Yeah.
when my daughter comes walking in from school, I can just watch how she's moving and I know pretty much what we're going to be talking about. And I think that's really fascinating to be able to look at. And then you get kind of this emotional picture, but then you can also get kind of nerdy when you look at their biomechanics and what their feet are doing and what their hips are doing, and their cadence is a big one. So I think there's a lot to it.
It's actually funny that you say that. My dad was a chiropractor. He doesn't practice anymore, but I think I remember being 9 years old in his clinic. Physical therapy was a part of his practice as well,
Yeah.
and he would say, "Okay, tell me what you think is wrong with this person when you see him walk," right? So we're watching the back of them. I'm like, "I don't know, their hip maybe, this and that." So it's just really interesting that you say that because it is true. I was kind of a nerd that way, that young as well. So that's great.
It's kind
Yeah.
of like I think of it as like someone's fingerprint. It's like their walking signature. I don't think we were all designed to walk the same. I think we were designed to walk efficiently. Like there's efficient walking, right? But to say that everybody should look the same, walking is, you know, it's a part of your environment. You gain things from your environment, how you're feeling, trauma. So there's a lot of factors that go into it. I don't know if you've ever seen that video, but it's this video of this little boy and he walks with his hands behind his back. He's a toddler.
Okay, no, haven't seen it.
And, his mom was really worried. She's like, I don't know. Why does he walk like this? And, then they were home and they figured out that spent a lot of time with his grandfather, and
I
his grandfather used to walk with his hands behind his back. So
Interesting.
I thought
isn't
that
it
was
really?
funny. Yeah, that's such a older, yeah. Yep.
It's like you're influenced by your environment. And I think that's important to consider when we're looking at someone's walking gait. We don't want to take away their signature per se. We just want to make things efficient.
It's interesting. I'm going to show my age now, but if you think about Charlie Chaplin or John Wayne, what's
Yeah.
some of the first things you think about is how they walked. Do you know who these people are,
I
Lauren?
mean, I've heard of them, but like, yeah,
I
yeah.
know who you're talking about.
How do they walk? Yeah,
Yeah, no, definitely. That's what
yeah.
they were known for, was that, especially Charlie Chaplin, was how he walked. Okay, well, let's take this a little bit further then. So, what are some of the biggest misconceptions people have about walking and foot health?
I think, well, first, I think walking is probably the most underprescribed medicine that we have. I mean, as movement professionals and teachers of movement, it should be on everybody's treatment protocol. We have all these corrective exercises, do these, hip bridges, do these, and it's like, I think walking should be on that list. I think that we should be able to say, how many steps a day are you taking? And what do we do to increase that and make things functional? Um, you know, I've done a lot of research on this lately, and the average step count is down. And it shouldn't be, because it's the most easily accessible, underrated form of therapy that we all have access to that we're just not utilizing. And there's more and more research looking at brisk paced walking, like faster walking, um, with reductions in dementia risk, in cancer risk. And I'm just like, we should be screaming this from like the mountaintops, because it is something that we can do, I think, that's accessible to all of us. So
Yeah,
that's kind of the
yeah, I
first.
was gonna say, excuse me for interrupting, but yeah, Peter Attia was on a recent 60 Minutes, and his whole thing was about level 2 exercise. Spend more time at level 2, and walking is the best form of that level 2. And what he meant by level 2 was, not, um, killing your heart rate, keep it at, 40, 50% of your maximum heart rate, go for a long walk, brisk walk, etcetera. So, yeah, the word is definitely getting out there about that.
Yeah, we interviewed Peter for the book that I wrote, and he refers to it as the talk test, which I love. Like, if you're walking, if you don't have a heart rate monitor, which, sources would say that some of those aren't really even that accurate, but he mentions using this talk test. So if you were walking with a friend, you should be able to talk to them. They should be able to know you're exercising. And that's kind of that zone you want to live in. But if you start to not be able to finish a sentence, for example, or you can walk and people can't tell you're exercising, right? You're kind of going into more zone 1, zone 3. So if you can carry on a conversation that's slightly uncomfortable, that's kind of that happy zone to be in. And I really liked that.
So that's one of the misconceptions, is that, you think you're doing enough walking and you're not. What about foot health? What are some of the misconceptions people have about foot health?
How much time do we have? Um,
Let's let's go with the top 3.
you know, I think number one is awareness. We don't think about our feet. We think about, every other part of our body, but we don't think about our feet the way that we should. If you think about, if I had a patient come in with low back pain, we would say, okay, let's assess them. Here's some core exercises. Here's some hip exercises. Let's teach you how to hinge, walk more. Someone comes in with foot pain. We don't think that the foot can be strengthened or that it can increase mobility, and it can. So we need to start viewing the foot, I think, more importantly, because of the foundation that it is for the rest of our bodies, just like we think about the rest of our bodies, that it can be strengthened, it can improve mobility, and we have to pay attention because it literally is what carries us through our lives.
Mhm.
So that's kind of a big one for me, is simple awareness. Start paying attention.
Okay. Um, what's quite interesting is that I'm starting to see more and more athletes. I'm starting to see more and more people who are training in more of a, let's say, foot conscious way. Um, how much could, though, if they don't do that, can poor gait mechanics actually affect the rest of the body? So whether it's an athlete, everyday person, if their gait mechanics are, I don't know whether you say good, bad, or indifferent. I don't know how you describe that, but and that affect the rest of the body, knees, hips, back, and even your posture or your breathing?
There's a lot there. Okay, so I recently had the pleasure of working with an NFL team in Atlanta, the Falcons. And I'm working with these guys, and these athletes, and I think people in general are paying more attention to strength. People know that we need to start strength training, right? Like when I was younger and I was a triathlete, we didn't really hear that. It was like swim, bike, run, get miles in, and call it a day. People are aware of strength now. So they're building very big, giant bodies, right? People are getting bigger, they're getting faster, they're getting stronger. They're building, like my good friend Jay DeCherry would say, jet engines on paper airplanes of feet. That is not going to work. Because we know that when we walk, for example, we put many times our body weight through our feet, but the foot was designed to carry those loads. Okay, 2 to 3 times our body weight. Some parts of our foot, when we're running, that jumps up to 11 times our body weight. But this thing was designed to handle those loads. Now, you build this big, strong body on top of a foot that you're not paying attention to, you're going to run into problems. So when I have a foot that can't propel me forward, that I can't push off of the ground, you're still going to get from point A to point B. You're just going to cheat the system to get there. And that's when we start to see these compensation patterns, or we'll see inefficiencies in their gait cycle, or they'll get injured. And, you really can. I'll give you an example. Ankle range of motion, ankle dorsiflexion, okay, is very important. If you don't use it, you're going to lose it. So the compensation, if someone has a lack of ankle dorsiflexion, for example, 3 things can happen. I mean, many things, but these are the top things we'll see. Number 1 is they'll lift their heel up early. So when they're walking, you'll see this, what we call early heel rise. And you might look in the back of their shoe and the heel counter will be all worn out and they'll be like, my dog ate my shoe. And I'm like, no, that's your heel. Okay. The other one is they'll hyperextend their knee. So they're finding different joints to compensate for a lack of range at the ankle. So someone might come in and say, hey, the back of my knee feels unstable. The other one is they'll lean forward when they're walking. So they'll use gravity, right, to just push them forward due to a lack of ankle dorsiflexion. So you could have heel pain, knee pain, and low back pain all driven from a lack of ankle mobility. So that's why the foot and ankle have to be assessed, because it will translate into compensations well above the foot and ankle.
Well, you'll be pleased to know in that kind of athletic world that the world deadlift record is in a barefoot shoe now. Lots of PGA golf caddies are wearing them. The players not so much because they get big contracts from some of the bigger
I know.
footwear brands. The mixed doubles team at Wimbledon were in that kind of world. So the message from people like yourself is certainly getting there in that athletic world. Let me just finish that question. But I'm just an everyday person, and I've got poor foot mechanics, poor gait. Is that going to give me back pain? Is that going to give me neck pain?
If you have poor foot
Poor
mechanics,
foot mechanics, not good flexibility, weak muscles, toes don't spread. Is that going to, go up the rest of my body?
yes. The answer to your question is yes, and I see it all the time.
Okay.
And is that dorsiflexion an issue of the Achilles, or what is that commonly the issue?
The lack of ankle dorsiflexion?
Yeah.
It could be a number of things. It could be that the foot can't pronate.
Okay.
Right? So that could be one reason. If they have a very stiff, rigid foot, it can block ankle dorsiflexion. It could be a joint restriction. It could be a muscle restriction. There could be a
Okay.
number of things that cause those restrictions.
Sure.
Yeah, you mentioned all these athletes kind of, paying attention. The research is coming with it. I mean,
Mm.
we know that being able to use your foot and use your ankle produces power. And I think it's really cool that people are starting to pay attention.
Yeah. MLB as well. That's a huge one that's
Oh,
starting
yeah,
to
of
really pay
course.
attention.
Yeah,
Yeah.
that makes sense.
So, Courtney, what are the most common signs someone might have dysfunctional gait patterns and might not realize it?
I think one of to kind of back that up a little bit, because we'll talk foot first and then how that translates to gait. One of the things I think that's most amazing about the foot is you can look down at your foot and see aberrant load, right? So whether you're a believer that your bunions are genetic, which, that's a whole nother conversation. If you look down at your foot and you see bunions or hammer toes or, feet that don't look like a normal foot, you can start to ask yourself, hey, something is awry here and I should probably start paying attention. So that's number one. But from a gait specifically, I think there's a couple things that we can look for. Number one, obviously, is an increase in falls. If you notice, falling is not, hey, I fell and, I slipped on something and, hey, I slipped again. Falls should not be, common. So if you're noticing that you're having an increased risk of falls, you need to pay attention to that. The other very big sign is cadence. There is so much research looking at how fast someone walks and the pace in which they walk. So, for example, if I were to have a slower cadence or a slower walking pace, that needs to be assessed because those are the markers that can predict things like dementias up to, some of the research will say up to 7 years in advance, which is huge, right? Like if we had a tool that said, this assessment can help us predict some type of future disease, why would we not all be doing it?
Absolutely.
Yeah.
Yeah.
And I think it should just start to be part of our, I talk about this in the book too, kind of vital signs. You get your blood pressure checked, you get your temperature, you watch someone walk, you look at their cadence. It's important.
Yeah. So walking more obviously is something that we can do. What else can people do to try to fix either gait, movement patterns, whatever the case may be? What are common things that people should start doing to wake those muscles or movements back up?
I think the first thing, and we'll do this with our patients, is, do you have good awareness of your foot? So if you were to take your shoes off and just stand barefoot, can you feel all parts of your foot? So for example, can you feel the ball of the big toe? Can you feel the ball of the little toe? Can you feel the heel? A lot of people can't feel those 3 points of their foot. They'll be like, I feel the inside, but not the outside.
Mm.
The foot should also be able to change shape. I think that's really important. So if you were standing and I had you rotate to your right, you should feel the arch of your foot on the right side lift and the arch of your left foot drop. And the opposite should happen when you rotate to the left. This is the foot changing shape. This is the arch being able to recoil. An arch that recoils is a foot that can propel forward. Think a trampoline. So a lot of people can't do those kind of simple things. The other thing we'll look at is, toe yoga. Can you lift just the big toe? Can you lift just the 4 toes? Can you lift all of your toes and spread them so you can see daylight within each toe? That means you have good awareness of your foot. You have good, function to your foot. And if someone can't do that, then those are the things we start with.
Did you just do all of that?
Yeah.
I was literally just doing them now.
I know, I heard you.
I
Yeah.
was just doing some of that. No, it's actually so. Lisa, my wife, is going to one of Courtney's team, Emily, and she came home and did these exercises, and that was one of them, moving all the toes over. And I'm going, damn
Yeah.
it, I can't do all of these.
Yeah.
So she started working on all of them. I mean, so for me, I played a lot of football, soccer when I was younger. I had my feet in cleats from age 5 till 35. My big toe crossed my next toe, etc. And then 15, 16 years ago, I came across this wacko duo of footwear guys from 300 years of making footwear who are making these minimalist shoes. And we all fell in love with each other, and I've been wearing them since. And gradually, my feet I can actually make my big toe go. I can actually spread the first 2 or 3 toes. I've still got a bit of work on some of the rest of the toes. So let's talk shoes. How do modern shoes like narrow toe boxes, or the world seems to be me all about cushioning now. And when people ask me, why do you think everybody's wearing these big cushions? And I think it's really simple. I think people think big cushions means comfortable, means pain free is what I think it is. So, but how did narrow toe boxes and cushioning change the way we move and how we feel?
Yeah, there's so much history to footwear that I just find fascinating because if you look at the beginnings of footwear, it was simply for protection. And then as, time carried on, it changed from function to fashion. And it was really a symbol of socioeconomic
Mhm.
status, right? The Krakau's and the Poulains in the medieval times, right? Were real pointy toes and things like that. And I think we've just, as society, have over the many years have grown accustomed to think that fashionable footwear is what we should be wearing. And we've caused ourselves a lot of problems. Um, it is one of the things I talk to my patients about consistently. I think it's extremely important. Uh, there is a very big difference between, say, traditional footwear, which is narrow toe boxes and all this cushion, than, say, minimal footwear, which is footwear that allows your foot to actually feel and move. I also think that the reason why we're kind of leaning towards more cushion, more protection is the concept of if you don't use it, you're going to lose it. And when the shoe does more of the work for you, so if you have a toe spring in the shoe, which is basically, you know, when the shoe has that little, looks like a little rocker on the end.
Mhm.
When someone goes and walks in that shoe, they're going to be like, wow, this is great. Must be good for me. There is research that will tell you that when you wear shoes that have toe springs, it will decrease strength of the intrinsic muscles of the foot. So nobody gets a free lunch. You don't just get to wear this shoe and think, oh, this is great without having some type of consequence. And I think people's feet are getting weaker and weaker and weaker. So we need more bells and whistles and more bells and whistles. And until somebody sounds the alarm, which I'm hoping to do and continue to do, then we're going to continue to run into problems because the whole concept with cushion is there is a massive trade off. And when you put your foot on a shoe that has a lot of cushion, your initial perception is, wow, this feels good.
Hmm.
But
Easy on the joints, right? Like that's what people say a lot.
and it's not. There's actually increased loads. It changes the rates of pronation when you wear more cushion. And the other factor that I think is really important is the sensory acuity that is lost. So we have hundreds and thousands of receptors on the bottoms of our feet that are screaming to feel things. It's what drives sensory information to our brains, and that affects motor output. So think about balance. I was in the gym this morning and I'm sitting there going, man, I got a lot of work to do. I think I saw one, and it was all like I was in the, weight training area, and there was one guy wearing minimal footwear. Now, if I was going to lift 200 pounds, if I was going to squat 200 pounds, don't I want to be balanced and stable? Yes. And I'm going to gain that stability from what I feel from the ground. So when I put 50 millimeters of cushion underneath the sole of my foot, do you think I'm going to be stable when I start loading? No. So we compromise sensory acuity, and that will affect balance when we wear more cushion. So you have to ask yourself, what am I doing? What are my goals? And those are things that I don't think that are being discussed
So
as far as the cushion perspective.
Yeah.
let me just pick up on that a little bit. You said one thing that was really interesting there that I don't think people focus on here, and I think it's an issue for minimalistic footwear. Is you talked about fashion, you talked about look. So when you look at that and you look at some of the shoes you were talking about, I won't name any of the brands, but with the rocker footwear, etc., some of the shoes, they're cool. They've got nice colors, they're cool looking designs, etc. They're um, not my favorite necessarily. Then you look at the first minimalistic shoes that came out, they had five finger looking toes.
Yeah.
I mean, you were basically had to be a weirdo to go and wear them, etc. And they went through a period of excitement for a few years and then they left. I've been trying to work with one of the minimalistic brands we talked about earlier around this. And I said, well, look, how do you take why are the big cushion guys so successful? I think it's comfort. It's perceived comfort. So it's a human feeling. So I was thinking, okay, so if you look at why does the guy lift the 300 pounds? Because he wants stronger legs. Why does he want stronger legs? He wants better definition. He wants his calves to look great. He wants his quads to look great. Females, who's got the most elegant, beautiful looking legs? Ballerinas, runners, athletes, etc. Their legs look beautiful. When do they look at the most beautiful? When they've got the shoes off. So I've actually been playing around with this and chatting about, okay, should minimalist footwear be talking about, yes, all the things you talked about, the benefits, but just talking about this just gives you great definition. You can be elegant, you can be stylish and be barefoot. What's your thoughts on that?
Watch someone walk in a high heel versus barefoot. I don't care if you've been walking in high heels your entire life. Nobody's comfortable and nobody looks very comfortable. And, it's a struggle. You're on a struggle bus. So walking is beautiful. It's a beautiful expression of movement. And I don't think there's anything more beautiful than that when you have your foot on the ground and you see someone that is powerful and strong and efficient when they're moving. And
who doesn't want elegant, defined legs? Male or female? Who doesn't want that? The other thing I would say to people is that, you think about the Romans conquered the world in flat sandals.
Yeah.
So don't tell me you can't be barefoot for 15 hours a day. That's history teaching us. So anyway, that's my passion out for the second.
We can't tell what he's passionate about, huh? Right? Yeah. For someone transitioning, because we know it can be a transition, for someone transitioning to barefoot or minimal, what's the safest way or most realistic way to start?
I think this is such an important conversation because this whole minimal footwear movement, if you will, I've been doing this for 25 years. Has caught fire in particular recently. I've seen it get real, it has really, like I said, gotten very, very popular, but it's not new. I think Vibram came out in 2007. And so these are conversations that we've been having, but I think the difference this time around is the education that's behind it. Because the majority of us, if you just walk around and look at everyone on the planet, is wearing a shoe that doesn't fit their foot. So by fit, I don't mean size 8 versus size 9. I mean the widest part of the toes should be the widest part of the foot should be the toes, and most shoes don't fit. So most people's feet are not functioning like they should. So to tell everyone, hey, we want everybody to just go buy a minimal shoe and you're just going to wear this. Now, I've been seeing patients doing this for a long time. That doesn't work because people's feet aren't strong enough. I thought it was interesting during COVID when, all these articles started coming out and they're like, don't go barefoot at home. Being barefoot increases foot pain. I'm like, no, they're missing the boat here. It's not the being barefoot. It's having weak feet. That's the problem here, right? It's not that they all of a sudden went barefoot and it's being barefoot is the problem. It's being barefoot with weak feet. That's the problem. So being able to talk to people and say, listen, I know you've been wearing X shoe, but we are going to transition you slowly into more functional and minimal footwear. And, the way I have defined this is I've separated those two definitions because there really isn't a clear definition on what is a functional shoe, what is a minimal shoe. So if I'm working with someone who's in a very traditional shoe, my number one goal is wide toe box. So a functional shoe is wide toe box, low to zero drop, right? So the research will be about 6 millimeters or below. So we'll transition them into that world. While we're doing that, we're saying, you're going to strengthen your foot. Do these exercises. Take your shoes off and walk around at home barefoot for 5 minutes. And then as they start to get stronger, we can transition them into minimal footwear, which is wide toe box, zero drop, thin and flexible sole. So that's kind of a shoe spectrum that we talk about. Every patient is different. Sometimes we'll just say, hey, wear this minimal shoe. You're going to start 5 to 10 minutes a day. We know that the intrinsic muscles of the foot increase hypertrophy if you do nothing else but wear minimal footwear, which I think is pretty cool. Now imagine if you wore minimal footwear and strengthened your foot. So it's slow. It is a slow 5 to 10 minutes a day, do a couple of these exercises, keep increasing loads, and then you get there
Courtney,
happy.
how do you
Yeah.
deal with once you put them into that wide toe box that most people think the shoes are too big for them?
Yeah. I love that conversation. Um, if the widest part of the foot should be the toes, when people most people's feet look like this. Most people's feet look like a shoe.
hmm
So when they go to put it into the shoe, they're like, man, this feels loose. It feels sloppy.
Mhm.
And that's when we'll start working on like lift, spread, reach. I will often utilize toe spacers. We'll put them on their foot, and then I'll have them use the toe spacers in the shoe so that they can fill up that space there.
Okay.
So those types of things can help people. But, I remember talking to Golden Harper, who started ultra running.
I know Golden well.
And
Yeah.
he used to say, if it doesn't feel too big, it's probably too small, you know, because people just aren't aware of how a shoe should feel.
Yeah. Switching gears just a little bit because I want to get back to gait and talk through performance and prevention a little bit. Could you dive a little bit deeper in talking us through how gait helps translate to better performance or recovery? I mean, I know it provides efficiency, but what what does it actually do to improve?
Let's talk about your big toe. The big toe, or the first ray, it has to be very stable in the foot because it takes on a lot of loads when we propel forward. So from a performance perspective, acceleration, the stronger my foot is and the stronger and more aligned my big toe is, and this I can create a stiffness to my foot, I can create better propulsion. Um, Training the extrinsic muscles. So think your peroneus brevis, for example. So can I talk shop here?
Sure.
Please. Okay. So peroneus brevis is on the outside of the foot. Okay. It's an everter of the foot. There's really cool studies looking at, if you want to get faster, train your everters. So being able to train these extrinsic muscles, so muscles that start on the lower leg and insert into the foot, and muscles that live within the foot, your intrinsic muscles, produce power and produce strength. And I think those are important things to consider. When you look at Achilles tendinopathy rehabilitation, for example, um, it's about how we load the tendons, right? So mechanotransduction. But one of the ways to go about doing that is by improving strength of your plantar flexors. I think everybody on this planet, if you're walking and or running, should be doing some type of calf raise, some type of push off, sled push, things like that to engage the foot, to engage the lower extremity.
Yeah, it's interesting. That was one of the questions I was just going to ask you. So, what key movement patterns or mobility drills? Obviously, you just explained one. You think everyone should be doing daily?
I think first and foremost, you have to assess your big toe. When we're walking, the big toe should have about 40 to 45 degrees of range of motion. So if you were sitting on the floor and you could lift your big toe up to 90 degrees, that's halfway. When you want to run or sprint, that number goes up to 65 degrees, maybe even a little bit more. So you have to have good range of motion of the toe. You also have to have good range of motion of the arch of the foot. So the foot has to be able to pronate. I probably teach my patients how to pronate more than I do anything else. People are scared of it. They'll sit in my office and they'll like be holding up their arch. I'm like, can you relax a little bit? Let that foot chill out. I say this 400 times a day. Chill. Let your foot chill. Let it lengthen. So those are all very important things. And that chill of the arch, that control of pronation allows ankle dorsiflexion. And then you have this beautiful cascade up the rest of the body. Internal rotation of the lower leg, internal rotation of the femur. So all of these things are just so important. So those types of things from a mobility perspective. And then from strength, you better have strong toes. Okay. You have to be able, if you were standing here and I leaned forward, the first thing you should feel that's going to stop you from falling is your toes pressing into the ground. Most falls occur at the initiation of gait. So if I was going to walk towards you, I can't control my fall and I go down. So toe strength is a factor not only for performance but also for fall prevention.
Yeah.
Strength of the foot, being able to control pronation, eccentric strength of the calf, being able to control walking down a hill or down a stair.
Yeah. Okay. All right. You hear about a lot of things that people talk about. Oh, I've got plantar fasciitis or I've got shin splints. Firstly, can you explain what they are? And then, how can people prevent those types of overuse injuries if they are overuse injuries?
Yeah. So plantar fasciitis, fasciosis, fasciopathy, plantar heel pain, there's a reason there's so many names out there because people can't really determine, is this a inflammatory problem? Is this a repetitive overuse problem? But I think what I do know is that we need to start thinking about how we're treating it. And I think that needs to look a little different.
Mhm.
Acute symptoms are treated very differently than chronic symptoms. We can all agree on that. If I have something that it's acute, so an acute plantar fasciitis, something is new, you want to offload, right? So a foot orthosis is a load modifier. It changes loads. So initially, there's great research that says, hey, you put a foot orthosis underneath a foot that has heel pain, you can see a reduction in symptoms. Great. If you don't use it, you're going to lose it. So the conversation should be, you're going to wear this foot orthosis for a while to help decrease your heel pain, but we're going to strengthen muscles like flexor digitorum brevis, who's the plantar fascia's best friend, because they share loads. So instead of having to rely on this foot orthosis forever, now we're just going to bring his friends to the party and we're going to get the foot stronger so that we can have an exit strategy for the orthosis. I talk about this study all the time because I think it's cool. There was only 20 people in the study. But what they did with it was recreational runners with chronic heel pain. And they had them run barefoot twice a week for 15 minutes for 6 weeks. Now, someone that has heel pain is like, no way. I need my foot, or I need my orthotic, I need my cushion shoe, I need all this song and dance. They did the exact opposite. They basically said, let's see what happens when we run barefoot on grass. Now, if I'm running barefoot, I'm not running on my heel, right? Because that hurts. I'm going to run more on my midfoot or my forefoot. When I run on my midfoot and my forefoot, I put more load through the plantar fascia. So basically, this treatment was doing the opposite of what we've done. It's instead of taking away load, we're going to introduce more load. 19 out of 20 people in that study at the 6-week marker had decreased heel pain. And here's the cool part. 12 weeks later, also had decreased heel pain. Now, I'm not saying everybody with heel pain, go take off your shoes but what I am saying is that's where I think we need to reconsider. Let the research guide you, not shackle you. So maybe, and I know there's research going on right now looking at this. What if we had patients with plantar fasciopathy, and what if we looked at, instead of decreasing loads, strengthening their foot? And I think we're going to see, well, I see it in my, so
Mhm.
I'll be very excited to see that research come out.
Oh, and what about shin splints? Because I've heard people say when you run barefoot or you wear minimalist shoes, you give yourself shin splints. So one, what are they? And can you talk about shin splints?
So the kind of terminology is medial tibial stress syndrome, right? So it's basically pain in the front of the lower leg. And I would actually say the exact opposite. So when you see people that tend to get shin splints, if I was walking, if you want to keep it real simple, overstriding is the enemy. So if I'm running or walking and I have my foot, it's all the way out in front of me, and I hit hot and heavy and I'm reaching forward and I overstride, I'm going to heel strike. And then the foot has to hit the ground. Now, if I have a very strong anterior compartment, which is where all those muscles live, it should be able to control or decelerate my foot hitting the ground.
Mhm.
If I don't have strength in my anterior compartment, when I land hot and heavy with my foot out in front of me, my foot slaps the ground. You ever hear somebody walking in the house, sounds like
Yeah,
it's coming?
Yeah,
yeah.
that tibialis anterior. Yeah.
They don't have good control of deceleration. I think movement, we have to be able to soften, and that's controlling deceleration. That's eccentric loads. So if I can't do that and I just slap and slap, I'm going to increase pressure in the front of the shin.
Mhm.
I'm not going to be able to control rotation, for example. Um, and so when you're running, if I have someone with shin splints, I will literally talk to them about switching out of their heavily cushioned shoes, getting them more into a midfoot, forefoot strike, because what did I just do? I just took away their culprit, which is the overstriding slap. So now we're just going to start loading different parts of the foot and ankle. Now they better have a strong foot and ankle in order to do that.
Yeah.
Mhm.
You mentioned earlier the gentleman squatting in the gym you were in, and you mentioned balance along with that. I want to talk about that a little bit more. What role does balance and proprioception play in all of this? And how can we train those systems effectively?
Being able to feel the ground is so important. It's how we interact. Walking is single limb support for 40% of the gait cycle. So when I'm walking, I have one foot on the ground for 40% of the gait cycle, which means that walking is a balance exercise. Um, when I'm running, I have one foot on the ground, so 100% single limb support. Being able to feel and gain sensory information is very important. Um, Here's some fun facts for you. We have all these receptors on the bottoms of the feet. When we turn 50, this is one of the beautiful things as we age. I'm turning 50 in less than 6 months here, so I'm very privy to some of this. When we turn 50, those receptors, it takes 20% more pressure to stimulate the receptors on the foot. So we start to lose sensitivity. When we turn 80, it takes 75% more pressure. We start to lose sensitivity to these receptors at a rapid rate once we hit 50. We start to not feel as much. You couple that with sarcopenia, muscle loss. So now at the foot, I can't feel real well and I don't have good strength. We have a very, very high rate of falls. You're going to tell me that that's not a factor? And then this is what we're going to do. Because you can't feel anything and because your foot's so weak, we're going to put you in a shoe where you can feel less and the shoe does more work for you. I'm sitting here going, this is not a difficult conversation. So those are the things that I think we need to be talking about, because when you look at balance, there is no better place to start to improve your balance and proprioception in what you feel than from your foot.
So many people sit all day and then try to fix it with a workout. Um, how does that affect our gait and posture negatively, positively, or just in general?
It comes down to a sedentary lifestyle. You have to move. It's literally what I talk about in the book. A micro walk. I think people are shocked actually at how much they're not moving. Like people will be like, "Oh, I think I move enough." And I'm like, "What's your step count?" And they're like, "Well, I don't have a watch." I'm like, "Use your phone." There's ways to figure it out. Um, I think people are shocked at how, like when I go to my office, I feel like I'm constantly moving around, but it's what I call ambient walking. It's like steps here, steps there, but I'm not taking that intentional brisk paced walk. And when you sit at a desk all day long, and I don't care if you're sitting or you're standing in one place, you're still not moving. And our systems were designed to move. So things like a micro walk. So a micro walk is 5 minutes and you get about 500 steps. I feel like that is um, a digestible amount. So just splitting up the day, whether that's like a movement snack. So you get up and do 10 squats, or you get up and you go take a 5-minute walk. You have got to break up the monotony of just sitting in place all day long. You know, Dan Lieberman talks about this in his book, and I really like a lot of his research. He wrote that book, Exercised. It's not that sitting is bad. It's, we need to actively sit, you know? You can deep squat. You can constantly be moving, like rocking your pelvis. It's just our ancestors, it's not that they didn't sit, they just didn't sit still all in one period of time. There was this more active component to it. And I think implementing just these simple things, like we make it too hard, like I said, I'm about to turn 50 and it's like, you need X amount of protein and you got to strength train and then you got to do this and you got to do that. And it's like, yes, I get it. But start with small things, right? By implementing just small changes. And I think that can go a long way. You can do foot exercises sitting at your desk, by the way.
Oh, I know. I've been there. Yeah, absolutely. Um, by the way, turning 50 is not as bad. Turning 60 is not that bad either.
Yeah.
It's not,
I feel
not
better now than I did when I was like in my 30s because I think my training is so much different. I was more of that
you
endurance
become wise.
grind. I mean, I
Yeah,
would
me
train my bike trainer in my garage for like 3-4 hours and I'd be like, man, I wonder where my neck hurts.
yeah,
It, and there was
yeah.
very little strength training. So I'm happy to say that I do feel better going into my 50s than I did when I was younger.
Well, likewise. Well, actually, I'm not going to my 50s, so I passed that one a while ago. Um, so you talked about walking, and you said that that's kind of like a type of therapy, small micro walks, etc. If it's done consciously. So, what other environmental or lifestyle changes, like walking barefoot home or textured surfaces, make the biggest difference?
Yeah. I mean, for example, like at my desk here, my shoes are off. I'm doing like little kind of mini calf raises. So sorry for everyone if I've been moving around on this call so much. Um, I have a little like kind of surfboard looking thing that I move my feet around. I think just taking these movement snacks throughout the day is very important. And, as much as you can, let your foot feel the ground. I have patients that they'll wear shoes in the shower. It's like as soon as they get out of bed, they put their foot into a slipper or into some type of supportive cushion. The foot doesn't need support. It is very well designed to function without it. The problem is that most of our feet are weak. So of course we think, oh, I have to buy this with this, to help support my foot. So you got to let your foot hit the ground. And
Yeah.
that's where I would start.
Okay.
So you mentioned cognitive issues with walking or lack thereof. What about, do you see any patterns between gait and emotional health? You mentioned that with your daughter, right? You know what kind of mood she's in, but patterns in general.
You know, that's such a great question. I think that, especially with cadence, when you start to see that lower cadence, that slower kind of walk, it does, when you watch someone that has that walk, you have to start thinking to yourself, are they in pain? Are they sad? What just happened? Because when you see somebody who has a, nice clip to their step, it's a whole kind of different environment happening. And some of my favorite research that I did for this book was on relationship walks. And, one of them was on walks with your daughter. So mother and daughter walks. And it was how walking with your teenager when you're outside, um, they found that the teenager would start to talk more and they would start to open up more. And then there was really cool research on walking with the elderly and how that was good for their social community. And I think that part of walking is looking at it from a community perspective is so important. My daughter and I, we're up in Evergreen, so she goes to Evergreen High School. Yes.
Where they had the shooting.
Yes. So it's been a very tough couple months for us. Um, and sorry.
It's
No,
okay.
it was,
It's okay.
yeah.
And to be able to say to her, let's go for a walk. Screw everything else. You and I are just going to go for a walk outside. And no matter what a terrible mood she's in, by the time we get back, even if she doesn't want to go, she feels better. I feel better. We've kind of, we're breathing, we're talking, and I'm so grateful for that. And that's why I think that something so easy as being able to walk outside your front door, to be able to help your physical, mental, and emotional health is so, so very important. And is why I'm passionate about the foot, because you can't do that when your foot hurts. So it's kind of this overarching kind of cycle that I think feeds off of one another. So
Well, I'm going to give you a confession now. So one of the things I've become more aware of. So my wife, Lisa, is 5'4". I think she's 5'4". I'm 6'3". So when we go hiking, my stride pattern is a bit great. I'm into working out hard. I want to push my steps. I want to get my highest intensity, etc. So I find myself often way ahead in terms of a hike. So a few weeks ago, I'm out and we are down at Chatfield Reservoir walking our dog, and my son was with me. My son is my height. And we're all chatting, we're all wanting to know what's going on. I'm walking alongside Lisa, and he's walking in front of me. And he's half turning back, and it was frustrating the hell out of me. So I just kind of like, and this is what you're saying, is that social aspect of being side by side, outside, walking together is so important. And if I was giving anyone a tip about that, and particularly a male, is don't walk in front of your wife or your partner. Walk alongside them. Sure, if there's one bit of a hill and you want to push yourself and you want to get your heart rate up, go and actually do that. But it's almost a level of, I felt impolite. Is that the right word?
yeah.
Unpolite,
Mhm.
impolite. I just felt rude now, and I'm very conscious of it now when I'm walking with Lisa now about doing it. And I'll say to her, "Is it okay if I go ahead?" Or she'll say, "Is it okay if I go ahead now?" So that really resonated with me, Courtney. So take that a bit further. You talked about aging. I understand that. What about hormones, pregnancy impact over gait mechanics over time? What about other things that happen in people's lives?
We do work with a lot of pregnant women, for example, and that's where I think gait it's safe too, right? Like there's not a person on this planet that I am saying don't walk unless they have a fracture, right? So it's one of those things that regardless of where you are in your kind of hormonal experience or if you are pregnant, that ability to be able to go outside and take a walk is always available to you. And, with hormones and with pregnancy, yes, things can change, but, not to the point where you can't get outside and walk. I have yet to have any patients where I've been unless barring some, medical condition where I have had to say to them, you can't do this. And I never really say, I always say, you can't say you cannot do this. It's what can you do? How do we modify whatever it is so that you can continue to do those things? Think of like a squat. So many of my patients are like, my doctor told me I can't squat. And I said, well, that means you can't sit on a chair. So yes, you can squat. We're just going to modify it. So it's that conversation of modification, but it's never the conversation of you cannot.
Yeah, I have that conversation with my dad all the time. My dad's had a stroke, and to go to the bathroom, he has to squat, etc. And he does his physio, and I was just telling him, Dad, you have to keep doing this for the rest of your life. You're going to be bedridden, and he's great at doing it. Courtney, we do this little thing at the end. We do this quick fire round, so you have to answer within 3 seconds
Okay.
of each one of these different
Give her a little more
questions.
than
Okay,
3.
5 seconds, 10 seconds, whatever you want.
Yeah.
But it's quick fire. So if someone listening could only change one thing about how they move starting today, what would it be?
Take your shoes off, let your foot feel the ground, and implement these little micro walks. Whenever you have, use walking as medicine. It's the panacea of medicine. So, regardless whether it's a physical ailment, mental or emotional, a 5-minute walk will carry you. It will do wonders.
Yeah. What are you most excited about researching or teaching next at Gait Happens?
I've been pretty fascinated on how the nervous system affects our foot posture. I think that our brains are and our nervous systems and our fascial system, really also play a role in how the foot feels the ground. I've those patients that have the very high arched, rigid, stiff feet. I think that by doing breath work, for example, and meditation and walking outside and getting the nervous system to dial down a bit, I think that you can start to see, and I've actually done this in my office without even messing with the foot. You can start to see changes in that recoil by telling the brain and nervous system, hey, you better chill out
Hmm.
because the foot is responding to the tension in the rest of our bodies. It's like everything is fight or flight, and my foot is trying to stabilize me, and I'm toe gripping, and my arch is lifting, and it's like, you know, just walk, make your sternum heavy, relax your foot. Pronation isn't, the devil. So I'm really interested in kind of looking at that connection with it.
Sure. Where can listeners learn from you or take your programs?
Um, Gait Happens has kind of a plethora of education. So if you're looking for just improving your own foot health, there's programs on there for foot strength and foot mobility. If you're a clinician or a movement professional, we have different level gait assessment courses. So how to assess someone's gait and then how to treat once you find what you're looking for. I think gait assessment is, one of those, when you get good at it, is one of those tools that can really allow you to hone in on prioritizing what's going on with the patient. And I think that's important. So there's a lot of education on that platform for both the layperson and the clinician.
So, Courtney, if I give you $10 million, okay, you can do anything with it. And you were advising with that $10 million a minimalistic footwear brand to make them cooler, to make them more effective. How would you use that $10 million with that footwear brand?
How to make the footwear brand cooler?
Cooler, more popular, get more people in minimalistic footwear. I give you $10 million. What are you going to spend it on?
Education. But getting people to understand the why. Because you could have the coolest looking shoe, the best looking, but if the people don't understand why this is so important, then it doesn't matter. And that's what I would really focus on. And that's what I'm trying to do. People need to understand the why this stuff is so important.
And I guess, one thing we didn't really talk about, which
Hmm.
actually surprised me, I am assuming that education starts with kids,
Yes.
kids' footwear, kids'
I always
movement.
say, if we put our kids in the right shoes, you'd put me straight into retirement because that's where it starts. If we hey, when you're in school and you get like a scoliosis check, I feel like they should also just look at their feet because if we start then a lot of the stuff that I'm treating every single day in my clinic, I'm no longer treating.
Well, one of the fascinating things, my neighbor's kids all wear minimalistic shoes, and when they come out, they always say to me, "We've got our fast shoes on."
Yeah.
So it's really interesting is that they perceive the
Oh,
minimalistic
fair,
shoes
because they're
as
not as
being
heavy
they're
and
not as heavy,
yeah.
they've got their fast shoes on. It's quite interesting.
My
Courtney
daughter's 15 and she's like, "You make me wear these platypus shoes." But, you know, there's a time and a place. I'm not gonna tell my 14-year-old when she goes to homecoming that she has to wear, I let
Yeah,
her kind of pick and choose. But when it comes down to it, when she has the choice where I know she's gonna be, like, out running or out being active, she's not gonna choose the shoe that doesn't feel good.
Mhm.
So that's where the education comes in, right? And now she'll be like, "Mom, what about this shoe? What about that shoe?" Because I'm literally talking to her, I'm educating her on why, not saying, "You can't do this." So I'm letting her choose, and I think that
yeah.
that has helped.
Yeah, that makes complete sense. Corinne, this has been fascinating. We always like to wrap up the end of our podcast with one of the core values of our podcast. So I mentioned to you it's strength, kindness, and perspective. So the world needs more kindness. So is there someone in your life who embodies all of those values, someone who's deeply influenced or inspired you that you'd like to give a shout out to?
Ugh, there's so many. I'm gonna try to get through this without crying. Um, Personally would be, my father. He's played such a huge role in my education, in my calming of my nervous system, as well as my mother, because I'm sure they're both going to listen to this. And if they have been an integral part of all of that. From a professional side, Tommy Shode he wrote Human Locomotion. And one of the things I love about this man is he kind of pioneered a lot of this stuff. He was talking about foot function years ago. I mean, when I was in chiropractic school, I read his book 400 times because it's difficult. And now that I've gotten to know him personally, he's one of those guys that when you ask him a question, he freely gives his education. It's not like, this is my work and I'm, harboring all of this for myself. His goal is to truly help other people. And that's what I hope to emulate is that to share the knowledge and to really be able to share what he has taught me and to be able to share education. And that's why I'm grateful that we have platforms now that can do that. But Tom has been um just a very dear person to me.